The work the University of Minnesota has done, and especially our Division of Cardiology and Cardiac Surgery, we have really impacted the care of patients with heart disease in Minnesota in a tremendous way.
The University of Minnesota cardiovascular team, they gave me a second chance at life. I had 6 open heart surgeries before my heart transplant, and ever since then I've been able to live a normal life. I participated in sports, which I couldn't do before. Go up to my parents' lake cabin, go fishing.
In January of 2015, on a routine scan, the first time I'd heard the word aneurysm came up. 2017, the aneurysm had enlarged significantly. They also found that my left anterior descending artery was significantly blocked. It was time that I needed a single coronary bypass. The care I received from the University of Minnesota cardiovascular team was phenomenal. They were up front, they cared for me as a person and not just a patient.
I began to have some issues where my heart felt like it wasn't beating correctly, and it was out of rhythm, and I just didn't feel right. I went over to the hospital, and they shocked my heart back into rhythm. A week and a half later, it happened again. Then I was directed to the University of Minnesota cardiovascular team. Brought me in and kind of explained the options, that we could go with some medicines, but that's really young to be on meds for the rest of your life, and so we also talked about getting this catheter ablation. So we did that 3 years ago, then had another ablation here in April, and knock on wood, it's been good ever since. So they did a great job. I felt like I was in really, really good hands. They took very good care of me.
Our patient care is exceptional because we have exceptional faculty. So you get people who really care, people who really know what's going on, and the people who are inventing the new therapies and the latest ideas. So if you come here, you get the cutting edge of what's possible in medicine.
It's a very exciting time to be involved in cardiac surgery and cardiovascular medicine in general. Surgeons and cardiologists are working hard together to develop safer and much less invasive operations.
If you look at our cardiology program, they started the VTVF program where they resuscitate patients who are presenting in arrest, and they save a lot of those patients. 90% of those people would have not made it if they didn't have that program, period. And half of them are walking out of the hospital back to a normal life. It's crazy.
It is not uncommon that patients and families walk into clinic or send a note or send a card and say, "Thank you for saving my life." That is something that gets you to work every single day.
The University of Minnesota is raising the bar for cardiology care in the state of Minnesota, and also we are populating the country and the region with our trainees, which is changing the way the cardiology problems are addressed in the country.
For many years, the University of Minnesota has been a pioneer, and the university is committed to still being the pioneer. We don't want to say we were the pioneer, we are the pioneer.
You feel the history of the University of Minnesota even in the walls around you, and I think it's something that we're very proud of and stays with us. First Pacemakers and Lila High's work, I think it is part of the mission of this place and is something that we feel every day.
We have people who won't stop innovating. They don't take their first invention, their first innovation and stop. They have their next and the next and the next. And when you tie together a whole series of inventions along a path, you can really move patient care forward. And that's what we've had here at the university.
The work that we do at the University of Minnesota in research and in the clinic is helping to address the leading problem in the United States. That's what's really inspiring, I think, about the work that we do here.
In most of the rest of the United States, cardiovascular disease is the #1 killer. In the state of Minnesota, it's #2, and I'd like to think that's because we're doing our job.
I don't think there are many communities where the academic center is so closely linked to the people that live in that community as there are here at the university. And when you bring together an entire population behind a medical field and medical subspecialty and a patient care need, there really isn't anything else that you need to get amazing things done.
It's just exciting to be involved with people that are this innovative and creative and trying to figure out how to support that research that they're doing that I'm so proud of, that I think is going to change the world.
This year, my heart transplant anniversary falls on Thanksgiving. So I'm very thankful for the U of M cardiovascular team and their research and what they have done for me over the past 19 years.
Big thanks, heartfelt, pun intended, yes, heartfelt thanks to the University of Minnesota cardiovascular team.
I don't know if I would be here right now if it wasn't for the whole team at the University of Minnesota. Thank you, University of Minnesota cardiovascular team, for everything you've done for me and my family.